this time, and I printed these few things, what the stroke is and the stroke facts, and then finally I talked about, there's a little card there, So if you look at the stroke, basically what happens is one of the blood vessels going to the brain gets blocked, temporarily or permanently. That's what we are dealing with. If it's temporarily blocked, we have symptoms. As soon as it opens up, symptoms are gone. But that's where we need to act. That's where we really, really need to be very, very proactive. We need to see doctor. We need to figure it out. Why did this happen? Most likely what happens is there was a blood clot which may have come from here, which may have come from heart, or which may have formed in the bigger arteries of the brain. It took off, went and clogged the artery. Fortunately, before it permanently damages the part of the brain, it opened up and symptoms are gone. So our job at that point is, let's look at it. Is there more blockage sitting somewhere which can be corrected? Do we have other risk factors? High cholesterol, high blood pressure, diabetes. A lot of people are undiagnosed. Millions of the people who have pre-diabetes, where is what we need to act? But we just don't go to the doctor, or we never found out, or we just say pre-diabetes, don't worry about it. That's where we need to act. So we can find by going to the doctor these risk factors, and we can try to minimize this so we don't have another. If blood vessel is permanently blocked, then we got damage. And depending upon which part of the brain suffered damage, we will have a symptom. If a motor part is damaged, we have a stroke, paralysis. If a leg part is damaged, we have a paralysis of the leg. If speech is affected, we lose our speech. A lot of time what happens is there is a very tiny area of the brain where all these functions converge and pass through that area. If we get a stroke in that area, then the whole one side is paralyzed, and we lose the speech, we lose our swallowing ability, and walking ability, and we are dependent on somebody else. So that's what stroke is. Now, just to bring the importance of stroke as a community, of course, individually a person gets affected, his life is changed, for the worse. But about 800,000 people every year in America are having stroke. 800,000. So it's not a rare problem. It's a very common problem. Every 40 seconds, somebody is having a stroke. Oh, I forgot to put. My son said, put this 40-second timer, and as soon as it comes on, tell them, okay, one person had a stroke. And or every 4 minutes, a person in America is dying from stroke. The good thing about it is, it's a preventable problem. 80% of the strokes can be prevented. That's a very, very good news. If we have a symptom, we have a problem, our loved one have a problem, we can act on it and can prevent. 80% of the strokes can be prevented. If we get this single point in our mind, and us, our family members, our friends, if we can communicate with them that this is a preventable problem, you did way more work, to help your family and friends if you can prevent a stroke there. Now, also, as I said, this is also 5th leading cause of death in America. And it's a leading cause, number 1 cause of disability. All of us talk about the quality of life, A stroke takes the quality of life away. When somebody has a stroke, they almost are dependent on somebody. They just lost their faculty. People who are like independent, and now they became, all of a sudden they became dependent. It's a leading cause of disability. It is a preventable one. 80% of the time you can prevent. The reason I'm saying again and again, because this is where we really can function, we can act, we can prevent this thing from happening. A lot of myths about the stroke. I think you guys already read about it. Some people think, oh, with stroke, we got paralyzed, there's nothing that can be done, and let's see how we recover. That's not true. You may be treatable, kind of strokes, bigger or smaller strokes, in certain areas of the brain. There is a medicine. So if you get in time to the hospital, it is a preventable problem. It is a treatable problem. There is a clot busting medicine we give, and we can open up the artery. And hopefully we can extend that window. It is overall in America, the window has been extended. Initially it's about 3 hours, then 4.5 hours. 6 hours, and now it's at 24 hours. There are things that can be done. We don't have, but last week, a stroke conference in the Hamilton Memorial Hospital, when we talked about it, we are trying to put this process in place where somebody has a stroke, had the paralysis, can we get them to some place, or can we have an expert here where we can go from here, artery there, and bust that clot and open up this blood supply, and then they start getting better. So there are a lot of things can be done. Just saying, oh, I had the stroke and now I got to get just a physical therapy. There are things that a lot of people don't know about it, but we can act on those things and can get better. Now, stroke only affects elderly. Here, my office people out there, we see every day, There are young people who are having stroke. I have seen a person, as young as a baby having a stroke, and older people, all of them know. But a lot of young people in their young life, they are having, a stroke. So that's not true that the stroke only affects elderly people. We need to act way early, start decreasing our risk, working on that. Also, there is a myth that stroke recovery only happens for the first few months after a stroke. Yes, there is a speedy recovery after we had a stroke. We start getting better quickly if everything was done right. And it's about a year when we are getting most of our benefit. But don't give up. This is something which keeps on improving if we keep on challenging our brain. Brain is an organ which learns. There was a time when people used to think that that's it, whatever function brain have, that's it. But what we have learned, brain does have what we call plasticity, So different areas of the brain, surrounding areas of the brain, can take over the function of the area which is lost. But we have to develop that channel. If somebody's hand is not working, what do? We send them to occupational therapy. Let's start working. They give them different tasks. So what we are trying to develop here is good channels in the surrounding areas, and we can gain the function. There are a lot of instruments that can help, but they also help to develop the channel. So even after 1 year, slowly and progressively, we keep on improving our deficits. Stroke is rare. We already talked about it. Strokes are not hereditary, though there are some diseases that predispose us to stroke. They run in the families. But if you look at the people, a lot of people who had a stroke in their family are more prone to have a stroke. Genetic factors do play the role in it, but at the same time, our lifestyle also plays a role in it. Most likely, if me and my wife, live in this, place, and most likely what she eats, I'm going to eat that too, and so it just feeds on. So our lifestyle, what we eat, and all those things, they do contribute to. But there are hereditary reasons which predisposes us to the stroke, And the last thing is, if stroke symptoms go away, you don't have to see a doctor. I already talked about it. Really, God, that's a God-given opportunity. You are just lucky that you had a stroke symptom and they just went away. So count on that, take advantage of that, go to your doctor, get your blood pressure checked, look at it. Do you have a diabetes? Look, do you have a blood clot here? Is your heart irregular? That is a God-given chance, opportunity to you. How can you prevent that? So just let your family and friend, don't ignore. You had a one-sided just numbness, that's better. Oh, I slept wrong. Why don't we get it, go and get it checked, because risk is too much. Who knows where the next one is going to be, we are not going to be lucky every time. One time we had a similar stroke, doesn't guarantee that the next time will be similar and get better. Yeah.
Can we ask questions?
Yes, sure.
Is there a way that you can find out if you've had many strokes in the past? Can you give us a test to find out if we've had some of those?
Yes, this is a very, very, very good question. Difference between a mini stroke and a permanent stroke, which commonly we just call a stroke, is whenever a blood clot is, clogging the artery and blood is not passing, we have symptoms. And fortunately, if that opens up and blood flow is restored, it does not cause any damage to the brain. So, if we do the MRI, we don't see anything new because there was not a permanent damage. The real stroke is when that blood vessel is permanently clogged and we cannot open it up and it's already caused the damage. So that's the difference between a mini stroke and a real stroke. So mini stroke is diagnosed just by the symptoms. When a person comes, say there are certain things that we need to look for. Somebody all of a sudden had a symptom. Suddenly they get paralyzed. Suddenly they have numbness. That is where stroke or TIA, what we call mini stroke, happens. So we cannot, by looking at the MRI, we cannot confirm somebody had a mini stroke or not. It's more by the symptom, talking to the patient. That's all. There is a difference between a mini stroke and a silent stroke. God has given us so much reserve brain. That part of the brain does not have any outside function. So certain areas of the brain are working like a back office. Nobody knows what is going on in the back office. They are just coordinating the functions of different areas of the brain. If stroke hits into that area of the brain, we may not have any symptom because we do not have any outside direct function, like our speed, like our walking, like our motor function, like our sensation, like our thinking. If that area is not affected, we don't have the symptom. It affected the deep area of the brain, which is just coordinating different functions. So we lose that little bit of coordination, we don't have any symptom, you don't even realize that. But that is a real stroke, that's a silent stroke. We do MRI first time and we see people, they have a lot of silent stroke. So there is a difference between a silent stroke and and a clinical stroke where person will have a symptom, and mini stroke, what we call mini stroke, when symptom resolve, you look at the brain, you don't see any damage. So that's the difference. But treatment of both, whether person had a mini stroke or whether patient had a stroke with a damage to the brain, is the same. We need to work on to prevent the next one, and that's what we need to do. Did I answer your question?
Thank you.
Thank you. And yeah, if stroke symptoms don't go away, so we talked about it. Then I gave a little card here, about stroke, and that emphasizes the importance of mnemonic called FACE, F-A-C. So FACE is somebody just complains, even says not feeling good. Obvious symptom, I got a paralysis, everybody knows. But if somebody says, I'm not feeling good, run these things, three things, ask them to smile. Any asymmetry of the face, that could be a sudden stroke. That's what we want to catch. We do not want to have a paralysis, say you had a stroke. Yes, we can do things about it, but we want to catch somebody when they are really, really having subtle signs and symptoms of a stroke. Ask them to smile. If there is a little problem, then we know what's going on. Then ask them to lift their arm. Also, we ask them to move their legs, so that we can find out even subtle problem. If you ask the person, hold your arm up here like this, and if one is dropping, that means there's a very little weakness. Paralysis is obvious, but a subtle weakness, you hold them up, and if the hands start going down, just turning this way, that means that person developed a stroke. Very subtle, symptoms. And also speech, ask them to talk and see, are they talking right, or the speech is a little bit slower. And then, as I said, stroke is emergency. It is an emergency. We need to act. Call 911, come to the hospital. We not only, say, oh, your symptoms are gone, we look beyond that. What is going on? Why you had the symptom? Where is the stroke is coming from? 70% of the stroke, we know the reasons, by doing all these, simple tests. But 30% of the time, we call cryptogenic stroke. We may not know the reason because the blood clot was so small here from the neck or from heart, it just was very small. It took off. When it reached to the brain, very tiny artery, it cannot go further. It just clogged that artery and we have a stroke. So whatever the small size of the blood clot was here, took off and went off. So we are looking here, we may not find it. But there are certain other genetic reasons also that people can have a stroke. We try to figure those out and try to address those issues. Any questions?
What is the clog made of? Cholesterol or what?
Yes, what we call clot, we call plaque, What happens is, if we start looking at, babies, and then we follow their blood vessels. We keep on looking over the period of years. There's a big studies done, and what we start seeing is inside the blood vessel, fat starts accumulating, what we call fatty streaks, And as we go further and further, that fatty streak start turning into a more and more deposition of the cholesterol and fat and smooth muscle. So we start, and then finally the calcium starts coming in. So that plaque is basically made up of cholesterol and some smooth muscle as well as fatty tissue. So that's in the wall of the blood vessel. That's where it accumulates. And if we have a little bit of high blood pressure, high blood pressure, when the blood is passing through that area at a speed, and that area is a little bumpy, so we start causing a little bit more damage. Area start getting rougher and rougher and rougher, and a time may come when, we may cause an irregularity of the surface. We may lose the covering, what we call the epithelium, and that's what we call ulcerated plaque. Now, plaque has an ulcer, blood flowing through there, blood just stays in that ulcerated area, the little deep area, and it's clotting. As we know, whenever blood stops somewhere, it just clots. So it makes another clot on the top of that plaque, and that's what we call thrombus. People can have 60% of the blockage, and if the blood is slowly passing through that, and it stays there in the clot, all of a sudden from 60% you got 100% clot, because that blood clot started forming, and all of a sudden. So yes, what we are talking about here, that clot is underlying plaque on the top of that clot of the blood, what we call thrombus. When thrombus breaks, goes up, it may take, full thrombus can go up and give us a major stroke because it's going to block major artery, or a piece can break and go to the brain and give a stroke to the smaller areas of the brain. So this is the odd combination of cholesterol and all this fatty tissue, and as well as a little bit of smooth muscle, and then calcium. By the time calcium gets deposited, we are lucky. Because what happened is that is not as risky plaque as a smooth, just cholesterol-containing plaque. Because that cholesterol-containing plaque is very, very, what we call atherogenic, means it is more, it attracts the blood more to stay there and make a blood clot, what we call thrombus. Anything else? Okay, well, yes.
I have a question.
Yeah.
You always say something, it's a fact, that mini stroke, what is the percentage or the chance that you'll have a stroke in the next?
Okay, yeah, very, very good, very good. See, anybody who had just a mini stroke, they are at a very high risk of having a major stroke. 19% chance that in the next 3 months, they will have a big debilitating stroke. So if somebody had a sudden onset of one-sided numbness, in a couple of minutes, it went away, we are, back to our work or whatever we are doing, back to our life. That one warning sign was telling you that something is coming, be careful. And that could be a major stroke. 19% of the time is a debilitating stroke, and that's it, that took our life, Maybe it took our life or left us, paralyzed for the rest of the life. Anything else? Okay, very good. So let's start walking, and now